present. Just because we're loud. So and to do that, I'm gonna call on each community in alphabetical order. If you can just state your name and present or anything fun you want to talk. Starting with Dover.
Jason Belmonte, Dover, present.
And then Medfield. That's you, Carol.
Carol Reed, Medfield Board of Health, present.
Thank you. Needham.
Ed Cosgrove, present.
Morning. And Sherburne.
Carol Beardsley, Sherborne, Board of Health.
Great, thank you. So now we are open, and I'm gonna now just make sure we go around the room so that everyone knows who else is present with us. We'll start with me, Carrie Janelle, Program Manager for the Shared Services, Charles River Public Health District, and going to my right.
Tim McDonald, Director of Health and Human Services in the town of Needham.
Amy Macri, Regional Health Inspector.
Ed Cosgrove, Board of Health, Needham.
Good morning, Sam Menard, Assistant Manager, the Charles River Public Health District.
Gail Barsa, Public Health, Dover and Shelburne. Good morning, Jen Casey, Admin Specialist for Public Health District.
Okay. And that is everyone present.
There we go.
And as I said, Kathy. Hello, everybody. As I said, Kathy Thompson texted me. She will be joining us shortly. So now the next step is public comment, and I see no members of the public present on the Zoom and none present here in the meeting room, so we can move forward at this. The next item is to review and approve minutes for February 25th. Those were distributed to you all with the agenda last week. Did anyone have any comments or corrections on the minutes?
They looked good to me.
Okay. All right, seeing none, then I'll ask, would anybody make a motion to approve the minutes?
I'll move for the minutes.
Ed Cosgrove moves to approve the minutes. Is there a second?
Second.
Jason Belmonte seconding, thank you. Now do roll call vote again. Dover.
Yes.
And Medfield.
Yes.
Needham.
Yes.
And Sherburne.
Yes.
Excellent, great, thank you. And I will say, just staying on the minutes for a moment, we do have minutes for our strategic planning meetings. Those will be shared with you all, and we'll ask to approve so just note that those will be coming, and I'll be asking for your review. And our next item, I wanted to leave time for community discussion today. I think that there's been a lot of work that we've been doing. There's been a lot of work gathering information for foundational public health services, discussion of budget and the like. And I wanted to leave space on the agenda for people to comment, ask further questions, or raise other topics that, we want perhaps the body should be considering. And I'll just note Kathy Thompson just joined us. Hi, Kathy. Thank you for coming. Nice to see you. I was just saying, Kathy, we have community discussion time set on the agenda, and I wanted to afford the members a chance to talk about the work that we've been doing. This is different from staff reports. I wanted to give some time to sort of talk about, okay, we've been asking you all a lot of information for foundational public health services. We've been trying to schedule things on cost tools and service tools, and we've used the fee cost study. There may be things coming up in budget season for each community, or just general questions on public health. Does anybody have anything that they would like to raise? Good morning, Kay.
Hi,
Hi,
sorry to be late.
that's okay. We're glad to see you. I'm opening the floor for community discussion. Hot topics in public health that people want to make sure that we that we ask about, or anything that is, lingering on your own community agenda that you wonder if other communities have experienced it or have thoughts about it.
I'll mention that in Sherborne, the bigger is, well, one of the many big issues on the horizon for us is the new accessory dwelling units policies in the state, which is fine, not a problem with that. And I gather there's another update that the health agent has based on meetings that they've been going to. So we think it should be okay, but there's also been some indications that the policy would be possibly allowing the ADUs to meet just state regulations and not local. But I think what I'm expecting to hear is that maybe they're back to, there's no reason local shouldn't apply. So we have been wrestling for some time with the issue of having two dwellings next to each other, one that meets local regulations and one that doesn't. And for us, it's the impact on groundwater ultimately and drinking water. So, but I don't think that, Dover is probably encountering something on that front, maybe lesser of an issue in the other towns, I'm not sure. So
Yes.
we get the point of increasing, and we've had ADUs in our town for a few years now. It's just that change and where the policy seemed to be going initially.
So, can I ask a clarifying question? So I'm not as familiar with the details of this. So if I understand right, Daryl, you're saying that the state regs, well, obviously, so state regs are different from local regs, and there's a question of whether that stands. And right, towns can usually be stricter.
So the state Title V is meant to be a minimum standard. So I don't know what Needham does specifically, but for example, most people have sewer connection and municipal water, I assume, in Needham. So if there's just a few scattered septic systems in outlying areas, you're not relying on the water beneath your feet essentially for the drinking water. So they're looking to set that state standard. It's something that's appropriate to municipalities that don't have the same environmental challenges related to septic. And then it's up to each town, and it's in the guidance and other statutes that the towns are supposed to then create local regulations to address local concerns and conditions. And
It
the
presents.
recent revision, the early read we were getting is that they seem to think that there should be lesser requirements for the ADUs in order to foster them. But I think that's evolving back to local should apply, but I haven't heard the latest update because I was busy with work yesterday, so I missed that.
Yeah, DEP still hasn't shared the final text of anything. The Executive Office of Housing and Livable Communities was really focusing on just meeting the state standard and not adhering to a higher standard, but I don't know where the final decision ended up making. We asked DEP, and the Coalition for Local Public Health, asked DEP to basically run the numbers again in terms of water usage and capacity in a house with high efficiency appliances and low flow water filters and that sort of thing. And they basically said they don't have time to run the numbers again, but last time I think they did the calculations were in the late 90s or the early 2000s. But
And for us, reduced water use is not going to reduce the pollutant loading. It's just going to be more concentrated. So I don't know that that would be my technical metric that would change
Yep.
how I view groundwater impact, but it could be an issue for municipalities who have a sewer system and the loading on that. I think that would be a really important number.
yeah, I think there's a real disconnect in what each community is looking for, depending on if they are
Yeah.
municipal sewer or they have, like Needham, for example, doesn't have any drinking water wells, no private drinking water wells, which is obviously a big difference in what other communities are concerned about.
And also for us, just the
Daryl,
residents would feel about that difference, you know, right next door, essentially. It's just kind of I think it would cause some strife.
Daryl, it just if you can know, your microphone seems to be going in and out a little bit. It's-
Okay, sorry about
So-
that. I'll switch
that's
over
okay.
the phone for
Just-
audio.
So we'll be having the volume stuck, I don't know how to fix that.
Okay.
Comcast keeps sending us messages that they're working on, you know, we should expect trouble.
Okay, yeah, I know I have on my laptop, my volume, yeah, sometimes it fades, even though I'm not moving and nothing's happening. Sometimes my volume fades and sometimes it comes in quite strong, so.
We can't shut this door, right?
No, we can.
Oh, yeah, oh, I wasn't sure.
Yeah. So, okay, so thanks, Daryl. I think I'd be interested to know if Dover or Medfield has anything. But I see Carol, you have your hand up and I wanna give you a second to speak.
My famous hand, and yes, a second. Thank you. I think I heard you say this is community discussion, or
Correct.
I just wanted to say, and I don't know how this fits, but in Medfield, we have no full-time staff, and that's a goal of the town in restructuring the department based on town meeting vote for budget this year. But in that vein, our board has been, we have stormwater regulations and they're stringent. We're not the only stormwater reg in the town, but many projects and proposals coming in front of us, taking that into consideration. In our community, it is the builder, developer, applicant's responsibility to use the project and review with Tetra Tech, who is the town's approved consultant, and then Tetra Tech presents to us a letter of conditions and walks us through. That being said, we understand through Mass General Law 111 that we have the ability and statutory authority to make reasonable health regulations. These past months, we've spent a lot of time understanding how a project with open meeting, 2 new turf fields and PFAS and drainage over our aquifer in the center of town not only impacts us through the lens of stormwater regs, but also many residents have asked us about public health and PFAS and impacts to youth. So in this, I bring it up because I feel that for myself, and I've talked to Tim about this and Cheryl Sabara, that our Board of Health and myself needs to have a stronger grasp on how to articulate our ability and authority to make more, to initiate health regulations that may be outside of our traditional scope, and then validate the reasons why. So I have gone to MHB trainings. But I did recently talk to Cheryl, and she said she would come to our next Board of Health meeting and basically hone in on a couple of examples. And this bringing up the ADU and how it may connect with public health and boards of health authority brought that up. Like, we are consumed in Medfield with these projects that overlap on our water supply and aquifer, but applicants are motivated and strongly financed to have their projects. We give them respect to be approved. So more training, more support for a board like mine to be able to be guided to fairly for the applicant and for the residents and for our goals to advocate for the right answers.
Is that, so I heard you say Cheryl's gonna be joining the Medfield Board of Health, and that's always or attending a meeting and sharing information with you all. And
She would like to, the
Got it.
next one. So
Got
we'll
it.
see,
Got
the
it.
next or the next, however the agendas work.
Got it. And that's always, it's always a great opportunity whenever you get to speak with Cheryl Sparrow. She's so knowledgeable and helpful. Are other communities interested in the same thing? And we should look to try and schedule a session with Cheryl for all of Charles River, or are folks content to have them come to their individual meetings? I see Daryl saying yes, shoot, that you're in favor of that. And I see Kay, you're nodding your head. You think that would be valuable too? Okay. And Needham, okay. So I can also reach out and see about scheduling a meeting with them. We could see if we could do it as part of our regular business. I think because we're gonna start getting into setting budget and work plan, that our meetings might be busy, so it might be a separate meeting, but I can work out logistics with Cheryl and then Jen and I will schedule with you all, see what we can do. So I heard you talking about understanding ability to regulate and understanding authority. Are there other topics that you'd want me to include with an ask to Cheryl? Anyone?
Yeah, I think what might be nice to be included in that is, we're using peer review, we're using consultants, we have a town attorney. I think it just would be really helpful to, sort of guide us to what our both responsibilities are.
Yep.
And what our ability is to, protect the public health of our town. Despite what, some of these projects are really big and some of them have, big guns come in with attorneys, and I think it would be nice for us to know what our rights and responsibilities as a board are.
Okay.
For those who haven't gone, I do think the MAHB board training is very valuable.
I have done that. Yeah, I do think it's valuable.
I think for us, one of the interesting examples, Ed, was Modera, the housing development on Greendale Ave, right?
Right.
The select board, it was a 40B submission. This is back at least, I think, a decade.
But
Can
and-
folks
Sorry.
can folks hear? Okay, I just want to check our, okay, good.
So it was a 40B going back a decade. It was between Greendale Ave and 128. And the select board decided it did not want it to happen. So it, asked town boards to find objections and concerns. The Board of Health had specific concerns about the proximity to the highway in terms of microparticle emissions and some new science about their impacts. The town, put up barriers, the developer sued, the town was getting its butt kicked in court and said, okay, everybody withdraw your objections. the Board of Health said that we don't work like that, and kept their objections, even though the town, had settled. And we basically said we were gonna block this under chapter 111, section 31, because you have super close proximity to the highway, your air intakes are towards the highway. You could make some changes that would accommodate health. And they said, well, we think we can win in court. You might, but you could also work with us and maybe come to a compromise. And they decided that was the better part of that. So they moved the air intakes to the sort of Greendale Ave side of the building, which was basically the front, so it was less attractive by having the air intakes on that side, but it shielded them from the highway emissions from the building's mass. They moved the playground and the pool from the back to the front, and they agreed to a higher level of air filter internally and a more frequent maintenance period, so that they were changed quarterly instead of every 6 months. So that was something town council wasn't involved in. We were just saying, we have this power under state law to basically prevent illness and protect health, and here's how we're interpreting this. It was very sort of nebulous, and I don't know if we would have won if we went to court. I'd like to think so, but they decided that a multi-year legal battle about this wasn't worth the risk, and that taking some steps wasn't a bad idea. And they actually included some of it in their advertising in terms of, we've taken extensive steps, higher level maintenance, higher level air filters, blah, 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 like they were forced to do.
And I do think because the Board of Health has had so many meetings over this, that there has been some changes. Instead of using the sort of tire crumbles or whatever the standard is, they switched to a tree pulp that's, organic. And, I think the Board of Health has had some positive impact that way, that it, even though it was much more expensive for them to go the organic route, it was, I thought that was at least a decent compromise.
I think it is, yeah. I don't know if it's ever about getting 100% of what you want, right? It's about figuring out how much of a concession you can get to protect health, and can you live with that?
Yeah.
But
I
it
think
sounds
that's where we're at.
Okay. All right, yeah, happy to. Oh, hi, Carol. Yes.
I just want to say that the difference is Needham has Tim, right? To lead, to take time, to investigate, and that example you gave is incredible and real. But when we look at capacity, which is why we're grateful to be in this group, we have limitations and need guidance. Like I said, to be honest and respectful of what the statute is for our applicants, for our residents, and for our town stakeholders, and when you don't do that, that work and that interpretation, like Kathy's a nurse practitioner and, et cetera, we don't have the same insight, knowledge, and obviously time. So.
But I think it's worth thinking about, because during that time I relied on Cheryl, I relied on some of my own research. We specifically engaged with a professor at Tufts School of Public Health and had a series of public presentations on the impact of microparticles, and he was doing a study with CDC and US Department of Transportation on residential units in close proximity to I-93, so we had some really interesting local information. I do think we should think about how shared services can help with something like that. It's not that we're going to hire another health director to share across the communities, but how can we provide some guidance and assistance if there is an issue the boards are facing? We can definitely think about that. Happy to put that in our list.
Thank you, Tim. Thanks, Carrie and Sam.
Sure. Okay. Kay.
I have just a quick question for Tim. Did you have a citizens group that was involved in this project?
That one? No. And interestingly, the person who we were arguing against, the developer's rep, moved to Needham and now is leading the group that's working on quiet zones because of their health impact. So to have quiet zones with the trains. So I think we sort of gave him an idea. He is applying it in the civic forum. We did not have a community group. There was neighborhood concern and opposition, but once the sort of the select board and the planning board buckled, the Board of Health was the only one that was sort of saying, no, we have concerns and they don't go away if you're losing in court. So.
The Perkins Coie of Greendale Avenue. Never mind. But I just want to say that I think your idea of providing some support to one another is through this shared services group is important. And I'm just thinking about a mechanism for that. And maybe it's to start with, it's as simple as having a little show and tell on a regular basis as a group that we spend, I don't know, X number of minutes a month, each talking about what are the challenging issues for us right now. And then we could brainstorm a little bit and maybe that could lead to something. But I do think that's the kind of support I'd like to see us evolve toward.
Great.
And it would be, and we could call it show and tell.
Right. Yeah, no, I mean, okay, that's great. And I know that is something I've heard from folks repeatedly, the value of being able to talk through issues that are coming up before you with others who maybe have experienced it or have some, some ideas. Yeah, so, okay. I can, I have a little agenda planner, and I will add that as a category for us. Daryl, I see your hand up.
Yes, I like that idea, and I was going to say that Sherborne has spent a lot of time on the artificial turf field issues. And the one that's coming up now before the town kind of crept up on us rather fast because we have been busy with other issues and weren't alerted to that. And it's not taking place in Sherborne, it's taking place potentially at the school that we share in Dover. So happy to share that information with you, Carol, at some point. Also, we were involved with a project 15 or more years ago with multi-towns, including Wellesley, and we're looking at that issue then as well. So kind of have a long history with the information.
Thank you. The Board of Health voted to approve the project, 2 turf fields at the Montrose School, and it is now continuing on with the Conservation Commission. Not closed, not approved, not permitted yet.
Yeah, so our concern besides cost, I don't really agree. There are a lot of studies that show that the organic route is not more expensive. It just depends on how you look at the costs and also how you manage. And there are the same kind of big interests that can step forward and have fancy presentations. But for example, the city of Springfield has been converting to natural grass fields, and those fields get a lot of use. So, and Springfield is, maybe not as affluent as some of our communities. So, anyway, it's a very complicated topic. From us remotely, part of the concern is just children's exposure to microplastics in terms of it not being in our town, but effect on kids.
Thanks, Daryl. Your mic was fading in a little bit at the end there, I think.
Wow.
But it was an
All right,
issue.
maybe
You're talking the challenge
I
of
don't
costs.
speak loud enough, I think.
I think well, but I do think it's maybe it's a combination, because I do think there's a technology aspect to it. Because your mic
I'm
sometimes
using
is
my
beautiful.
phone now, so I think it's me.
Okay, but sometimes your voice is beautiful and strong, and sometimes it's not. So, and just noting. Okay,
Yep.
Is there? Ed, yeah.
I was just gonna mention that an issue that's coming up with Needham is over gas-powered leaf blowers. And people are objecting more and more to the decibel level, sometimes the time of day they start blowing leaves, and putting some kind of control on it. Whether it's an outright ban, no, you can't do it in Needham at all, or you can only do it at certain times of year, certain times of day. And I didn't know if any other towns have had any issues with that.
Yeah.
I know that Newton has Dover, Sherburne, or Medfield had any leaf blower, either town initiated regs or citizen requests?
I'm not aware of any. Are you?
No,
Oh,
nothing
sorry,
in
Daryl.
Dover that I'm aware of.
Nothing in Dover, okay?
Yeah,
And
Medfield
I'm
is
not
looking
aware
at
of
it from
anything
the
in Sherborne.
Sustainable Medfield Committee. And looking, and what they're doing is they're trying to bring some companies in that have some grants that to make switching, especially for landscape companies, where they think a lot of the, as opposed to just individual homeowners who don't generally have the high powered equipment and the louder and the pollution, and to have them switch and just doing some, and Medfield is looking in the future at switching and just trying to find some money and to, see how feasible that would. So at least it's in people's thought processes. Nothing's been done at this time, but Sustainable Medfield is looking at that and how they can support that.
I know it's coming up as an issue here in Board of Health, and also it's coming up at town meetings. So there's going to be some discussion.
Okay, it's moving along.
Yeah, and it is our green medium introduced in the citizens petition, so
That-
that's the Sustainable Medfield equivalent.
Yeah,
Okay.
yeah, that's great.
Yeah, and I know with that discussion, I was present at the Board of Health meeting in Needham when someone came and proposed it, and they're talking about, I mean, one of the challenges is how do you implement this, and
Exactly.
what's the its impact on staffing, and if you're controlling this, how do you make sure that you have staff available to measure it? So it's a complicated question once you get to the place of implementation, never mind, all of the discussion that happens in advance of do we engage in regulation.
Enforcement's a major issue.
Yep.
Because it could be a real time consumer.
Right.
Is it gonna be the police? Well, I don't think so. They're not gonna do that. Is it gonna be the Board of Health staff that's gonna do that? That limits, our staff is limited. Again, with anybody else, I guess. But the point is, even our staff is limited. We can't run around and do that all the time. And one of my overriding principles has always been, don't make a mockery of regulations. Don't pass something you can't enforce. And so I'm always concerned about that.
Yeah, there's always the issues that come are complex, and I think all these things I hear, and as a Board of Health member myself, right, I hear these things and then I think, oh right, and this is something we've talked about, Ed, when you talked about the do you pass something that you can't enforce? That came up in a different topic when on my Board of Health in Reading, and so I think to Kay's point, there's a lot of value in these conversations, even if the actual content doesn't track. There's the practice, there's all the process piece that matters. So okay, so we will add show and tell to our to our agenda for further things. And I do try and make sure to have time for community discussion like this. I can't always, if we have other things that we need to review or vote. And I'm glad that this worked well today. And I think I like show and tell better than community discussion. It's a little clearer, a little more on point for our conversation. So is there anything else anybody wants to kind of put on the plate before I move on to our next agenda item? Okay, seeing nothing. So then I just wanted to talk briefly about what we have upcoming. We have completed, just about completed, the cost tool submissions for the Foundational Public Health Services. project, and I know Medfield, there was an issue with it getting access to the SharePoint site, and I know that it has been a busy budget season, so I think that may be still in process, but we are complete, we are moving on, and thank you, Jen Casey, she's been beating the bushes trying to find dates so that we can meet with each of y'all and review the service tool. That is going to be more time consuming, and I just want to prepare folks for that. It's not really whereas the cost tool was something you could do with one or maybe two people from your community, and we could talk about the nuances of budget items and make sure we're answering right. With the service tool, we really want a broader participation. So I know the Needham meeting, we've got a big group, and we'll be trying to make sure that we get feedback from your Board of Health, and we want you to think about who else do you need to have in that conversation with us. We're scheduling initially for 1 hour meetings. I think that we're gonna have to come back. I just, again, setting expectations, and our deadline for that is April 18th. Manise Afridi, who I think all of you have met, most of you have met at this point, is our BME consultant. She's really skilled at moving people through the tools. It's really a pleasure to get to work with her on it. She's heard a lot of questions before and can help guide the things. I found her participation to be helpful. In talking to other communities, I think that it has been useful as well. And she will work with us on the service tool. But so I guess I'm thanking you in advance for dedicating some extra time and doing some thinking about what percentage of your department's time is spent on those five capabilities and 8 foundational areas. It's nuanced, as I think you've all discovered as we've done some of the cost tool piece. It's not necessarily as straightforward black and white. So any questions on that process? Any comments on that process? To date or ahead? No. Okay, we're just gonna keep going, and really thank you all for your participation. I am going to talk to Medfield because I think that what we want to do is look at, can we do a small group? Can we do a couple of people from the Board of Health and perhaps another staff person or not?
Yeah, we don't
to
have
try
any
and-
staff.
Well,
It's a problem.
except I was about Kathy McDonald potentially, and get that feedback. I think that it's valuable to have people who maybe aren't directly engaged in service involved, because it gives them an understanding of what the work is, and they may participate in the conversation and say, oh wait, we do that over here, and it's a thing that a Board of Health member maybe isn't aware of. So I think that not only are we getting data about activity, but we're building opportunity for kind of recognition in the broader community. Talk with my hands. So so I think I think I'm gonna reach out to Medfield. We do need to schedule that one. Oh, look at that. That's like on cue, Kathy. Hi, welcome. I was just talking about the next phase of our foundational public health services work and the service tool and how to complete that. I know that the cost tool in Medfield is not quite finished yet, but we do need to move on to the service tool. And I'm proposing that we have a small group of a couple members from the Board of Health and potentially you joining them as well to review what kinds of services are in the town. So I'll follow up with you all on an email afterwards. I think I'll reach out to the chair and to Kathy and kind of take the lead from that and figure out how we organize you all. Everybody else we've got on the books, right? I think got scheduled. So thank you. We're almost done. We'll almost be done with that. It's going to be quicker than the IMA, the intermunicipal agreement. Much quicker. So, okay. And then I just want to highlight that we are going to be starting next month. I want to have some conversations with you all about our budget and our work plan for FY26. I don't know that I'm going to have a lot of details from Office of Local and Regional Health on the work plan specifics, but we know our budget is not increasing. So I think it's worthwhile for us. We'll review where we were on our expenditures through term 2, and we can have some conversation about what the budget might look like. Jen Casey and I will be able to give you some info of, we budgeted well here. Or we have a little bit of, our needs are different this year. Maybe we need to look at shifting. And I'd like to get your engagement and feedback on that. We're fortunate to have a set level of dollars that we know will be coming to us. Those dollars aren't going to increase though. So just want to make sure that folks understand that. And there are costs that do increase, including staff costs. And we'll try and share info to draw that picture clearly for you. I don't have deadlines yet for my submission time, but I think it probably would be the end of May to Office of Local and Regional Health. We'll have to submit a budget and work plan. So we are going to start moving fairly quickly. Any questions, comments, requests about that? Anything you want to make sure we include in a presentation to you all? Or okay. All right, I will do what we do, and I will be guided by your comments and to our best. I do want to, while I'm on, I know just a side note for Dover and Sherborne and the arrangement with our public health nursing time. I believe Town of Needham Town Council reached out to Dover and has not heard back as of this morning. So I don't know if Jason or Kay, if either of you has the ability to check in on that. Sometimes it helps if it's an inside request as opposed to a external.
I'm sorry, Carrie, who reached out to who?
Town council from Needham. His name is Chris Heap, would have reached out to Carl Valente in Dover.
Okay, gotcha. Yeah, I had a quick chat with Carl yesterday. He acknowledged that someone reached out and that he hadn't responded to them yet. So it sounded like he was going to be doing it anytime now. So
yeah, that's great. Yeah, just to keep y'all aware, because I know, we have dollars set aside and we're prepared to deliver it. We want to make sure that it's set for how Dover works. And then I think there's the question too of how Dover and Sherborne are working in terms of documenting for hours that they would be paying out and any record keeping. So, okay, that's just a fine point on our budget. Okay. There have started to be some conversations about what will be allowable costs in the future. We know allowable costs are sometimes they change. And one of the things that's been a question has been with the state's development of this data solution metric, which I think some of you have seen presentations about. There's going to be kind of a phase-in process for that. And once that system is fully established, I believe that the state will no longer be including electronic reporting, electronic inspection software as an allowable cost once that system is is fully established. So I just wanna flag that, because that obviously would have an impact on our budget. I will share more info as I get it. That is the second highest percentage of our budget, after staff costs, so, just making you aware. Ed,
No, if they don't cover that, who's supposed to cover that, the local boards then,
correct?
for the town budget?
So the towns could cover the cost from their own budget, or they could choose to use the state data solution metric
Oh.
and use that as their electronic reporting and record keeping resource.
With the caveat that it's unclear how much customization they're gonna do,
Right.
so that it will be permits and inspection software for state regulations. But they may or may not, or it's not unclear how far they will go down and how long it will take to do a community-specific regulation like a dumpster regulation or a concussion regulation or stormwater or things like that.
That could get very expensive,
Very expensive.
so I can see that.
Yep. So, yeah, I think just that's worthwhile to flag that, it may not be, well, yeah, I mean, it's, when it say sort of big box versus boutique, when you have a contract, you know, you, with your own, and you have a boutique service that maybe has a little bit more specialization and customization, and big box is, you know, more, cost effective perhaps, but will not have the same degree of customization and resources, so. We don't have to make a decision, that's not something for this year, but, just think it's worth flagging. Okay. All right, I'm gonna move us now to staff reports. And I wanna start at the bottom of the list, if I may, and do the environmental health work group. Just if there's any updates, Amy and Sam, on activity from last month?
Sure, I have our notes up if you want me to run through them. Yep. So we met again on March 18th. You should have all received an email with the minutes and some projects we're working on, just links to them, which we will be doing moving forward after every EH meeting, just so the advisory board has a really clear picture of everything we're working on. So, final version of the food plan review application was sent out to everyone, and our next step will be having individual towns discuss customization with us if they want to add or remove anything from that application. So please let us know, including advisory board members, if you want to take a look at that. That is a link right there in the email, and we're also having discussions with staff. That includes things like local regulations or just anything else you think would be useful in that application. We continue to discuss the workforce standards, which our first step for that was a survey was sent out to all of the staff and the Board of Health members, asking them to just fill out a quick survey to see if we're meeting minimum workforce standards. That includes applicable trainings and certifications, everything from making sure people have completed like very introductory level videos on train, to making sure you've completed ICS 100, which is like emergency preparedness training. And then for the EH staff, it gets a lot more technical in terms of the certifications they need. So thank you in advance for taking the time to do that. I know a lot of people have already completed it. If you haven't, please do so when you get a chance. It only takes a couple minutes. And going through the survey, Amy put it together really nicely. You're only completing the section that is applicable to you. So it is not that like entire lengthy survey. So for instance, if you're a Board of Health member, please just go to Board of Health members. Oh, they don't have, I'm so sorry. What was I thinking? The other thing we are gonna be verifying with folks is that all staff and Board of Health members do have a Train Massachusetts account. We're gonna try to verify that on the back end. If we can't, we might be doing some sort of outreach, but if you guys all remember, maybe about a year ago, we had submitted everyone's emails and you should have received a follow-up email to have registered a Train Massachusetts account. If you have no idea what I'm talking about, please send me an email and we will make sure your account gets set up. But basically, this is the platform that Massachusetts is now using for all their standardized training. So all the training hub trainings and things are on there, but it also includes all of those local public health institute courses that we all used to take through like a BU MHOA website have all been migrated over to Train Massachusetts. So if you don't have an account, I'm just gonna say this one more time, including all Board of Health members, all Board of Health members in your town need to have an account. And we'd be happy to follow up with anyone who has no idea what we're talking about. We've talked about this a lot before, but we continue to sort through the unmet performance standards tracker. Amy has sent up a wonderful spreadsheet. There's a link right to it in the notes she sent out if you want to take a look at it. We are still asking folks to let us know if they would like to prioritize any of the unmet standards on that list. We're gonna give people about another week for feedback. We haven't received much yet. And in lieu of that, Amy and I are gonna go through and use our own sort of logic to prioritize, but we would really love some input from everyone, and we'll be continuing to tackle those in the EH work group. Some of the things we've already tackled was about frozen dessert permits. We've started talking about recreational camp and making sure like appropriate reporting is happening there. We are checking when folks about like solid waste and transfer facilities. Right now, we're getting an idea, do folks even have these? If so, what standards are applicable? So that's where we're at right now, but really any feedback you all have would be great. And then we continue to discuss a few other things that staff bring up, very much how this group today kind of brought up, you know, things that maybe we're all trying to tackle individually. We're leaving some room in those meetings for staff to discuss things. So some things that have been brought up is like administrative search warrants, lead determinator certifications, and trouble staff have had over the years with things like that. Yeah, so we're making a lot of progress. And like I said, moving forward, all advisory board members are gonna receive an email with all this information after every meeting. So you can feel free to look at those, you know, at your leisure. Did I miss anything? Okay, cool.
Thank you, Sam. And I'll just, on that question of prioritizing the standards, Jen, Casey and I met last night with BME in prep for the strategic planning meeting on Thursday, and they did some categorization work. They're gonna share some things with the meeting group on Thursday that will help add to the information and add to the cause. So I thought that was a nice, they analyze it slightly differently, and they have a little graphic. So we'll keep talking about that, and hopefully we can get some clarity on priorities, and we'll keep moving forward. So let's see, Jen Gangadaran is out today at a immunization conference, and so she gave me her notes, and I'm going to represent, and I'm really glad that I have Gail across the table, because I know Gail has some things she'll share about what, you know, what have been happening, and she'll correct me on some things when I misspeak. So first off, we have the numbers for, in terms of MAVEN coverage. Gail, you're fully covering Dover and Sherburne now. Congratulations.
Thank you, Jim.
It turns out that there was a typo issue that was part of the barrier. So we've learned a lot, and we've put in a request through a couple different paths to the folks with MAVEN and with the public health nursing training group, to get like a little checklist or a little flow chart of what are the steps, so we can figure out where we go wrong or where we could do better for the next time we need to add somebody to MAVEN. So thank you for being your test case. Sorry.
Just a quick comment on
Yeah.
MAVEN, they recently added another field.
I have.
Oh, you got that?
Yeah. So I know, what Jen continues to cover Medfield, and she'll do so until that position for public health nursing is filled. Her notes on, it should generally, flu has decreased. COVID has also decreased. Has not decreased up where I live, but, and I do have numbers for Medfield. I think that we need to have a conversation with Medfield about how they'd like reporting to happen to them. You know, Jen is tracking that, and it's whether it needs to be emailed to the chair monthly, or what, you know, what the reporting mechanism should be. I can just run through them. You know, there's 10 cases of influenza, there's less than 5 of Lyme, there's less than 5 of novel corona confirmed, and there are 7 that are probables for corona. So it's still there, and it's very real. And I imagine these numbers are similar to what you're seeing in Dover and Sherburne. Yeah. So then going bigger picture, there are a couple things about Maven that have changed slightly. So one of them is that, I think it was last month, we were talking about who was able to be on Maven. And we had very clear guidance from the state that there were no restrictions, that it could be an administrator or an admin. And then that changed. Unfortunately, we were so excited because we thought we had the answer, and I know this was a question in Sherburne about access, and we thought it was crystal clear that anyone could access, but they have revised that slightly and confirmed now that administrative staff who are not regularly looking at Maven cannot be the backup person. So the criteria is less about medical licensure, and it's more about you need to be actively using Maven. You can't be someone who has an account and can just hop in, because they feel like there's a need for understanding a depth of experience with the system. So I know that changes things for Sherburne, and what has happened now is that Jen Gagarin will be the backup for Sherburne until such time as, you know, Sherburne maybe identifies somebody else to provide backup. I don't think that impacts any of the other towns right now. Needham is acting as backup to Jen Gagarin in her role covering for Medfield. But we do have Jen has a chart which gets revised as these rules change, so we will we can share that regularly with folks, so you'll know who the backups and coverage responsible parties are. The other thing that has changed with Maven is, and we're still trying to get details on this, it was announced on a Maven call that they're now requiring that there be an environmental health person listed in the system for each community. It's not, we don't know if there's actually been a communication to the Board of Health. Yeah, Daryl, thank you, Sam. Daryl, I see your hand up.
Oh, I mean, you could keep going, or I could ask my question, your choice.
Why don't I, yeah, because you probably have questions about this too. So let me just, so on the, so they are now requesting that there be an environmental health point of contact for every community that's listed in the Maven system. So that means that Jen Gagarin or Gail, or I guess it's just you two, or Needham can go in and enter the person. So we need a name for every community. We can't tell you who that person will be. There's no, the town decides. What I was looking for was whether there'd been a communication to the Board of Health, or whether there'd been any kind of notice beyond this mention in this Maven meeting. You know, it was shared as this is a requirement, and so there's some tension of we have to get this done. Is it right? Except that it's not up to us. We need to ask the community to decide who they want to have. So I know Needham has popped in their, they're one of their inspectors. And I know that, Gail was having conversation with Dover, and I don't know if you've had conversation with Sherburne as well. Okay, so that's an open question, and then for Medfield, I think the question is, and we talked about this a little yesterday, of, it's the town's decision, we won't put in an individual for you. The town could decide that they want to be still a phone call, just as things happen now, of it's the main number for the Board of Health, and someone leaves a message, and was from there, it could be an inspector. There's questions of whether to put someone who's on a contract, is that within the provisions of their contract to be that point of contact. So little changes, but with the point of doing this is so that if there is a foodborne outbreak, for example, and they have a link to a restaurant, for example, they want to be able to share that information to an environmental health person in the community. Okay, stopping now. Daryl.
Okay.
You look puzzled.
Yeah. On the last point, for the environmental health connection, given that if they're thinking inspectors only, those are people who are part-time. So when we have an administrator, again, I think right now I'd run it by the whole board and see what the requirements are, but I think I'd rather have it be the administrator who would then contact the appropriate staff person. Again, our staff is so light that we just, they might not reach that environmental health person on their own.
Right, it's not, I think the idea is that would be an inspector, but they do acknowledge that it's up to the town who the point of contact is. They're not requiring. So yes, I understand what you're saying. And I guess the question is, Daryl, in the absence of an administrator, is there an individual, would you just want it to be the Board of Health phone number? And it'll get fielded and distributed, or is there another method?
I think in the short term that would work because the part-time staff, who are mainly two, the agent and then the administrative assistant, check the phone regularly and then tag team and make sure that the other person knows if the other person should know about something.
Yep. So it doesn't have to be
and then back
27
to the Maven
available.
account. Sorry.
Sorry, Daryl, what was that last bit?
I was just saying back to the Maven account. The last thing I heard is that even though our administrator and administrative assistant have historically checked Maven on a daily basis, which seems like qualifies for that regular use. But the last I heard is that because they are not actually public health nurses, that they still could not access Maven. So, but we could cross that bridge another time on the details.
The disclaimer was because they do not have the ability to open a case and investigate it.
Right.
Okay.
So it's right, thank you. That's the key factor. It's, because people can check, Maven, there are people who have privileges to just look and see what's happening. But the ability to initiate a case investigation is the criteria.
Oh, so there is a check. They've not wanted to instigate cases because that's not their skill set qualifications to do that. But checking has always been something. So if that's still possible.
And there were some privacy breaches that the Maven contact had said led to this decision to secure Maven.
Okay.
The only people that are active managing cases, which makes sense.
Okay.
Yeah.
Okay. So
Thank you.
not necessarily, just in the past, someone is using the system, so that's the policy change. Okay. not
Right,
town
so
budget.
it's active use now. Yep, active use now, not simply monitoring and, able to log in and look and share numbers to someone else, for example. Needs to be active use, so. And sorry, Kathy, you were saying about the environmental health, you were asking about.
So like we have a part-time administrative assistant that's
Right.
there for 4 hours Monday through Friday. Is that enough? Or does it need to be somebody who's readily available in an emergency kind of thing?
They didn't specify, I think this was in their vision is that it's, a point of contact. And again, they didn't specify who it has to be.
And you're thinking restaurants are typically open during most like business hours anyway. They're probably not open at 3 a.m. for an investigation to even happen at that time, so.
Right. I'm just thinking after 1, things do happen.
Right, so I don't,
That's
so
all.
my understanding is that this would not be an emergent point of contact.
That's good.
Right, so, emergent cases, that's a different aspect. This is a trying to, let's say, close the loop of sharing info, because depending upon your public health nursing coverage, there might not be a connection with the environmental health staff in saying, oh, hey, maybe you should go check this restaurant, or other examples. So, okay. All right. Any questions before I move on from Nathan? No. Okay. So as I said, Jen's at an immunization conference right now. Jen and Gail did have a meeting talking with the public health nurse here in Needham about vaccination programs in general, because that's been something that's been an express interest in the communities. And we want to take the opportunity to underscore, reiterate. I know I shared steps with Bedfield when we were having a conversation about trying to do vaccination clinics of, there are like 10 steps that you need to have in place, and vaccination is step 10. And step 1 is you've got to have a medical director. And we clarified that you have to have a medical director that authorizes, even if, I think the example was B12 injections, right? And it was, couldn't somebody, if they have a doctor's order, could they do it? It needs to be covered under your community's medical director orders. So you can't just come in with another physician's order. So I'm underscoring that to you all. I know you know and you care. I have, raised the issue with the Office of Local Regional Health. I have asked Jen to raise it with her points of contact with the nursing training hubs, because we know it's not an allowable cost, and there aren't a lot of, there's not clear guidance on the role. There's no credentialing requirement. We have some questions about it. So I guess I would suggest to every community that if this is something that is important to you, that you explore what ways you kind of can raise this as well, of how do we arrange for a medical director. And I will continue to have the conversation, as will Gail and Jen. Okay? Because we can't even talk about vaccination if there's not a medical director. Okay, I'll finish for that. And then I'm just gonna say one more thing, and actually I'm gonna hand it to you, Gail. So I know Jen and Gail did a hands-only CPR training. They were trained here and are preparing to go out and offer it in the communities. So they're both really excited about this. Gail, do you want to talk about that?
So we observed a demonstration in Needham where there were 10 community members, all ages, with older parents, someone that had a sick spouse, that just wanted to understand and know how to use hands only. It's not a certification, it's a demonstration, an initiative pushed out by the American Heart Association. More people in the community that we can engage to act in an emergency situation and start hands-only CPR, the better chances there are for survival of the victim. So Jen and I are planning to do this at the Dover Benefits Fair on April 8th. It's going to be very informal. Walk by, can we demonstrate, can we show you, here's the website. Here is an app that's called Pulse Points that will let you know where the closest AEDs are in a community should this event unfortunately happen in front of you at a grocery store, wherever you are. It's just getting more information out to the community, to those people that are interested in it. Daryl, I've talked to the COA about this. They are interested in having some type of event for their members and partnering perhaps with the fire departments too around. But it's not formal CPR certification and training. It is strictly informal, hands-only CPR, no giving breaths, and just an overview on the use of the AED too.
Which, yeah, I think it's great. I know Jen brought this to me, and it sounds, yeah, thumbs up. I agree. I think it's good. And I was saying to Gail that I can connect her with someone at the Sherburne Fire Department who may be a good point of contact as you're building those relationships in town as well. And maybe there'll be something that they're interested in supporting. So yeah, I think that's great. And I what I love about it is it shows the opportunity that exists for community work, simple public health interventions that are, low cost, low investment, but have high potential yield and great ways to get visibility in the community. So I'm excited for
We're gonna borrow your equipment though.
yes, right,
For it,
and that's fine.
And it's for
Part of
all
it.
populations, because we will cover pediatrics, choking,
Nice.
which is a big deal.
Yes,
So I think
Yes.
all populations will benefit from it.
that's great. Thank you. And on this note, I'm gonna say, Kay, I know at one point you had mentioned something about communications training and wanting to learn how to use Canva was one of the specifics. And there's a on train, if you have a training account, not anyone, you can access a training that's designing effective
Infographics.
designing effective infographics. It's a good course, and part of it includes guidance on how to use Canva. It may be, it's all free. It's based on free accounts. So I had shared that with Gail and Jen because I know that was something you were interested in, Kay, and I'd sure like to see if we can find some funds to do maybe a little bit more communications training. But in the meantime, there are these resources that, were developed intentionally to support it. We knew it was a need in the community. So happy to share the link on that if anybody wants to take it. It's a pretty engaging
It's a good
little
course.
class. Yeah. So, and it's free and it's available 24/7. So when you forget how to do it, you can just pull it up and find it. And I think there's a little job aid too, the sort of steps. Yeah. So I think that might be something that Gail and Jen can use as you think about hands-free, no, not hands-free, hands-only. All right, different thing, hands-free phone, for anything, anything like that. I think, trying to see if this is a way to help do some outreach. And I'll be interested to see if you guys find it useful, and we'll continue looking at what else can be developed. So, okay.
Just have a question about availability of mannequins. I know when I teach CPR, the Medfield Board of Health only has like 2 adult mannequins, and I borrow them from the schools only because I still have a connection there, but just wonder about availability of mannequins to do that in the community. Is that something that we could share or?
So I don't have an inventory right now of what people have, but we certainly could do that, and then I think we'd have to figure out just how to track it. So, yeah, because I know that there are mannequins. I know there's an instructor that comes here and you meet them once a month, and they use the mannequins. They're not a staff person. They offer a training. So I will check with so let's see, so we want to get maybe a inventory, if we could we'll get some info from each town. Do you have any, what do you have? And then we'll see what, if any, I mean, I guess at minimum, we could do this is what the towns have, here's the person to call if you want to see if you're running want to run a training. So we can put that together.
I mean, you can certainly share them.
Absolutely. Yeah, absolutely. I mean, if somebody's willing to make the ride over to pick them up, and and they're available. I laugh because I'm giggling because on the Friday before they have this class, the Friday night and the Saturday, Hannah, one of the public health nurses here, lays out the mannequins on the floor. And it's startling when you come around the corner because they're these little pediatric and adult half bodies lying out there. But yeah, it's a good resource. That's a great question, Kathy. Thanks.
No, because when I did a training for the medical reserve corps last weekend, but like the 10th graders were having a class at school, so I had to go like the end of the day on Friday, clean everything, get everything back by 7 a.m. Monday morning. It'd be nice if there were other mannequins available.
Okay, so we can figure out, what does each community have and who we call to see if you can access them. Okay. All right. This is the part of the day when it gets exciting because I try and share my screen. You never know what's gonna happen, not yet. So as we talk about work plan progress, I'd like to run through with you all our progress so you can see concretely all of the work that is happening here. Just bear with me while I log in. So now I'm plugged in. So now how do I share my screen? I'm not appearing on here.
During the meeting.
Oh.
Okay. Override the,
Okay. So let me join the meeting.
yeah, just turn the volume
Haha.
on. New Year. And then I'll make you a host.
While I'm doing this, and I'm trying to distract you all from me from does that do we have anybody running the marathon, the Boston Marathon in April? like maybe not us, but maybe we know someone amongst our our crowd. I always love going to watch. When I wasn't working the marathon, I like to go. It's Newton, just after Newton Lower Falls, because it's the place where, famously they come up the little hill, they cross the bridge, and then it's just that there didn't used to be an aid station right on the street in front of Newton Wellesley, and runners would just run up the hill to the emergency department. And then they decided, well, let's put an aid station down here and see if we can, help triage some of the folks that maybe don't need to go all the way up. So, but I love it. It's one of my favorite days, and it's one of the things that makes me happy about it turning spring. But I guess we don't have anybody in our departments running. Okay, we'll find somebody. All right, so I'm joining. No, it's not, it's,
Okay, so it's page. So.
thanks for your patience, folks. Hopefully you can see my screen now. And this is why I get confused. This menu is, it's not small.
Dashboard?
Yeah.
Yeah.
So this is the dashboard for Smartsheet. And, you know, you can see we have our spending, spending for T2, which is the light blue. That is, you know, slightly more, which is appropriate. We had additional, we had payments out for things like relevant in T1, and then we added staff as well. So we added the public health nurse, regional public health nurse role in T2. So we are right on track for spending. The report, the final will need to be submitted in the beginning of next week. We have done, yes, happy to say we did a pretty good job budgeting this year, and I look forward to showing you the results on that. You can see the tracker here, and it shows the specific line items and the payments out and the percentage remaining on each of the line items. And I'll just point out, whoops. So, you know, there's a higher percentage on both the nurse and the health inspector roles, and that's because those positions were not filled immediately in the budget year. So there were additional dollars on those line items, and we'll be talking to you about shifting those dollars to cover some costs. You know, so for example, membership fees, we're slightly overspent on the line item, and we're allowed to do that because we know that we have, and also health communication, because there are dollars, available funds. So the reason for the overage on the health communication side is that we purchased Pocket Talk translation devices for all the communities, and that was, I guess maybe that's the place where I didn't budget properly, and I didn't have quite the right dollar amount. We only had $2,000 in the communication line. But those Pocket Talk translation devices will be available for folks in every community. You can have one in your office, you can have one with your inspector. We also purchased Pocket Talk devices for shared services staff, and for our training hub. We find them to be a handy and useful device. And it'll be something that I suppose it could be useful, like mannequins, you know, thinking about sharing resources, right? I mean, it might be something that would be helpful in your community if you want to share it with another department in your town if they have a need. We are generally doing well with our spending. Sorry for that pop-up. I want to try and use buttons. use cells and then it tells me I don't have access. And then the other piece is the work plan tracker, and forgive the scroll. This is all of those deliverables. I'm going to go to a different activity tracker. This is all of those deliverables that we talk about. We talked about when we were setting our work plan. We talk about it, kind of progress reports, and the first section is grant administration, and that you'll see we are complete in all of those. That's, making sure we have monthly meetings, we have a list of the participants, we've got letters of commitment. We meet, more than once, we meet once a quarter, we meet more, et cetera, et cetera. The only yellow here that not started is, it's actually, right. No, it's not accurate. Oh, right. So it's just the have you completed T1 and T2 training or reporting, and that's what's in progress. T1, as you know, was submitted. We're complete on all of our intermunicipal agreement work, so you can see those pretty green things. And just drawing your attention here. Column is so you see that things that we have not started or were in progress have been made complete. Our foundational public health services work, we're moving along pace. We talked about that. The deadline is April 18th, and then there will be some report out back from BME, and then I am required to report to each of your boards of health about the results of it. And we've already started talking to BME about making sure that there's a presentation, and we'll share it with you all, so you'll know what you want to have. You will be able to tell us what you want to have in that presentation in advance. Inventory management, that's something that we have made good progress on. Thank you to Sam, particularly for working through with our spreadsheet. It's a lot of work to create an inventory system, but once it's set, it's a simple process to kind of keep up. And I know Jen Casey is making sure that we have things like our proper purchase order numbers, so we can track that where things work. So we have good controls in place. We are in progress. We'll be training on and starting to implement it later this month, I think. And sometime when we're not too busy, we would love to show you our inventory spreadsheet. But not everybody loves looking at inventory spreadsheets. So, and I can't see your faces. You can make all the faces you want at me about it. But we have a pretty good system. We've worked hard on it. Strategic planning, as you know, we are moving through. The only thing that is not started on that is presenting of the findings to each community board of health. And then we have the self-assessment piece. So that is complete. Thank you all. We have, I know Amy started this month with a process for how to request help. That's something that TPH wants us to have. Do you have some sort of SOP for requesting inspectional support? So we experimented with something. We'll see what people think about it, and decide if we need to revise it and get that set in place. Sam and I have worked hard to create a system for managing and supervising staff. We're pretty happy with that. Town of Needham has made some changes on their own onboarding and hiring work, which we're going to make sure we incorporate. We're pleased with our progress on that. We have carried out the hiring plan. I always keep that in progress. We're never complete on hiring, and some of that's being a little superstitious, and some of that is just, there are always things changing. So we carried out, we follow the budget, procedures, we keep y'all apprised on that. Disease control, this is what I refer to as the kind of the public health nursing aspect of our work, and you can see that that's all in progress, whereas we were not started at the end of the last reporting period because Jen Gagarin had just joined us. The reporting period closed on October 31st, and she joined us 10 days before. So Jen has made some good progress. It's easier to make progress now that Gail is on board, and I know that Gail and she have been working together, and they'll continue to develop things like the flow chart of who is covering for each community and information on how to cover how to communicate with questions about Maven, and what else do we have? The ongoing monitoring, I think there's, we have ongoing monitoring mechanisms, making sure that every community is following the same thing. When Medfield fills their position, well, those conversations will include that person, and this just builds in a nice redundancy. We're clear, everybody's following best practices, and can support each other in need. Like I know, Gail, there was I think Jen said there was without getting into details, there was a kind of case that had come up that she had not had to work through before, and it came up as part of your training, and so it was, yes. So day 3, right? So I mean, there's always something new, and it's those kinds of things are great opportunities, and I think. When Medfield has a person, same thing, it might be, oh, hey, we have this thing, and if you haven't worked through one of these particular reportable diseases, maybe you want to talk to us about, here's how we're working it through. So I think that's going to be a real benefit.
We're working also with the state, it has 4 regions for regional public health out of UMass.
Yep.
And Jen and I are meeting with that nurse
Yes.
for support and understanding of what's happening on the state level and communications.
Yeah.
Tamara is great.
Yeah, and I know you had a few meetings with Tamara, yeah. So Gail's referring to a new program that the state just launched, which is a training specifically for public health nurses. It's a 10-year contract. There are 5 nurses. So whereas there are 10 training hubs, there are 5 nursing assignments. Each nurse consultant has 2 training hubs assigned to them, and their job right now is doing some assessment, understanding what are the capacities, what are the needs, and they'll be working on developing training and providing access to training specifically for public health nurses. So it's really nice that that program has launched, and they are learning about the communities and getting ready. And I know it's been a good support for you.
For any new person.
And we shared, actually, Jen G and I shared some of the documents that we have created here in shared services. So that onboarding and that pre and onboarding document, we shared that. The information that we shared about setting up for vaccination clinics, we shared that. And there was something else that we shared. Just to let them know what things we've found to be helpful and useful here, and have them consider whether it's something, do they have something like it? Do they want to make something like it? Help them understand what the needs are. Tamara is a former public health nurse, local nurse for the Neshoba Valley District, so she's very experienced. Carol has a question too. Oh, thank you. Yeah, can't see faces. Thank you. Carol, did you have a question?
Yes, a couple. Number,
Yeah.
in looking through the budget that you shared as far as spent year to date, etc., I didn't see the BME strategies. Is that funded out of the 350,000 or the administrative fee taken from the grants? I just didn't see that.
No, you're right. Thank you for pointing that out. That is not, so, and just to be clear, our funding is 325,000.
Forgive me.
no, it's okay, I just said, because there's a big difference with the 25. So we're 325, and the strategic planning costs are covered by the it's called the CTCI funding, the contact tracing and case investigation dollars that
From before.
that
Okay.
are activities that would benefit the functioning of
Mhm.
this group of communities
Okay, great.
to respond to another incident if there was one, tap wood, if there were another pandemic. So that is not there. We have some what we call it, I refer to it, it's one-time money, and those dollars are closed off. They're not going to be available for future use.
Yep.
It's not a good spending practice to use them to pay for
Yep.
staff positions or anything. So we're using it for those kinds of projects.
Yep.
Thank
Great.
you. Thank you
Next,
for putting that out.
I have
Yeah.
another one. So
Yes.
I manage a grant and have been paid by grants since 2008. Are you able, the unspent funds for hiring delay, to roll over to FY26, or are those?
No rollover. No rollover. All dollars that are not spent are returned. So we do our best to budget tightly and well, and make sure that we spend,
That's out of your control. The
Yeah.
stuff, because I had, a suggestion, if they were able to be even contracted for, I know I've said this before, shared services, health communication person,
Yeah.
to be able to,
Yeah.
okay, thanks.
Yeah, I mean, and I'll just, one of the things, and I'll talk about this next month, but it's a great point. In trying to figure out how do we solve a health communications express need, one thought I had was, could we use potentially some of those CTCI dollars to make a contract with someone to provide some training, and also to build perhaps a library of some templates of documents in Canva or something like that, so that they'd be available for individual communities. And I'm looking at Gail because she's right across from me. But if Gail wanted to do a flyer for something, maybe they could build some templates that would be easier to use rather than starting from scratch, and might have some of the same information that we're all interested in. That's one thought. It was down lower on the list because trying to get strategic planning going. So potentially, if we could do that with those CTCI dollars. But I don't see room in our 325 to procure that kind of service with our existing dollars. Answer your question? Awesome.
And I will say this, we use the APHC, Academic Public Health Corps. We made a toolkit for our 4 towns for opioid abatement. I miss them and that initiative of those great volunteers managed. And the template and communication. Thanks, Carrie.
Yeah. Okay. So still just finishing up in the infectious disease piece. One of the pieces of work is to create a resource hub on case investigation. So documentation, protocols, reporting requirements, and that is something that Jen G has had her eye on as she's been building capacity here for herself. And I know she's been sharing these thoughts with Gail, and that is in progress. Jen is also connected with other regional public health nurses in the state, and is learning from them about how they're organizing information, because they have the same requirements. So I think we're in good shape on that as well. And then we have the workforce standards, right, so training opportunities to meet the performance standards. This has been an interesting one. We've had some interesting conversations because, on the capacity assessment, folks identified, it's things as either a training need or an awareness. What was the barrier in meeting it? Training, awareness, staff, or funding. And there were a number of things that were identified as training, but as Sam and I have talked about a few times, the work is starting to show that it's not exactly training in the way that this work plan envisions. It is more, I didn't know that there was a form to do this. Here, let me see the form. And Sam, if there's anything you want to add on that, I think we figured out that it's not formal training that is the need. So we're working on teasing
Yeah, not
out
trainings
that.
like complete this workshop or certification or things like that. It did seem to fall more under awareness category or like a simple, here's step 1, 2, 3 to do this procedure, which I think is a little outside of what the training category was meant to do. Meaning I think overall there wasn't a ton of training needs in the region.
Right.
More awareness stuff.
Right, and we say, in part that's due to the fact that this group has well-trained, and knowledgeable staff, that everybody has little gaps in knowledge, and I think frozen desserts was a common one for people, and it's like, oh, I didn't know about that, but I can, I just need to know and understand what the process is. So we're actually, I have to talk with OLRH about this because it's not really a training need. And this is like the bane of instructional designers, because everybody says, we need training. And then when you go in and talk to folks, it turns out we don't really need a whole training. We just need like a one-on-one, or we need some coaching with people, or we need to create a fact sheet. So we're teasing out what those needs are, and it makes it easier. And again, I think it's a testament to the resources that we do have in the community. Unfortunately, it looks like we're stalled because there's not an actual training piece, and I have to figure out how to report that with Office of Local and Regional Health. And then we're also stalled on evaluation of trainings that we offer because we're not offering trainings. And unfortunately, our choices are not started, in progress, stalled, or complete. I guess stalled is better than stuck, but anyways, and we are actively encouraging cross-training and tag-along. That's been a great benefit from this collaboration. And Sam just talked about earlier about the work that's being done to document where folks are in terms of what their training requirements from the workforce standards are. Thank you for answering the surveys. A little shout out that one of the things in there is that everybody needs to have ICS 100 and NIM 700. And it's not everybody's favorite training, but it is something that folks are supposed to do. So I think it's on that survey you got. And there's that thing. I'm going to do it for you, plug it for you, Sam. We need to ensure that all folks have a Train MA account. And we are, as we look at, I think Medfield will be the first group that was going to be adding a new inspector, and will be sharing information about onboarding, pre-boarding, and making sure that the requirements for tiers 1, 2, and 3 training for both housing and food are clear and understood, and will be part of the process for every town as they add new environmental health staff. So, little whirlwind tour. Thank you for indulging me. I'm going to stop sharing so I can see your faces again. I don't know if there are any questions on that. I'm pleased with our progress, and I feel like we've been doing okay. And in communication with you all, I haven't had any complaints. I've had questions and asks for additional. But any comments? Anything to add on this? No. Just continue as you are. Okay. So that is all I have for it closes out our staff reports. I don't think we have any other business. Anybody have any other business they want to raise? No. Okay. So next meeting, Thursday, we have virtual meeting, strategic planning, 9 o'clock. Invitation's been sent out, meeting's been posted. And then we have our regular monthly meeting on Tuesday, April 22nd, the day after the marathon. And then we'll have a strategic planning meeting on the 24th. And I think, oh, look, I've got other business on there twice. I apologize. It's always something. So, I think that is all we have on the agenda. And unless there's other business, is there anybody who would be willing to make a motion to adjourn? Ed Cosgrove made the motion to adjourn. Is there a second? Second from Kathy Thompson from Medfield. And now I'll do a roll call vote. Start in alphabetical order. Dover.
Yes.
Great, thanks, Kay. Medfield,
Yes.
thank you, Kathy. Needham,
Yes.
thank you, Ed, and Sherburne.
Yes.
Great, thank you. So that's a 4-all vote. We're adjourned. Thank you all. See you on Thursday.
Thank you.
Bye, thanks.
Bye.
Or who's the train now?